Hello, my name is Dr. Anne Baldwin, and I'm a professor of physiology from the University of Arizona. I'm also a Reiki master, and I've been practicing and teaching and researching Reiki for the last 18 years. As you know, Reiki Medic-Care is offering a program so that frontline medical professionals can receive Reiki remotely to reduce their stress and anxiety and enhance their sleep and well-being. And I am here to explain Reiki to you in terms that will make sense to scientists. So Reiki is the Japanese word for universal life force, and it's the word used for the system of natural healing. It's based on Far Eastern traditions, and it's believed that the life force energy flows through every living being, and that diseases and disorders arise when the energy flow is blocked. So to become a Reiki practitioner, one experiences a process of initiation and practices self-treatment daily in order to open up the flow of Reiki through the body. So the Reiki practitioner becomes a vessel for Reiki to flow into and then out through their hands. And during a treatment, the practitioner usually places their hands on or near the client's body, so the Reiki energy stimulates the client's body to heal itself. And the science seems to show that it triggers the appropriate release of neurotransmitters and hormones. And we know that Reiki works from anecdotal evidence, but more importantly, we know it works from the peer-reviewed scientific research. And the current status of Reiki research is described in my book, which you see here, Reiki in Clinical Practice, a Science-Based Guide, published by Handspring Publishers. And of the 85 existing published original Reiki research studies so far evaluated, over 50 were informative, and 30 of these indicate that Reiki is effective in reducing acute and chronic pain, stress, depression, and anxiety. Reiki also enhances well-being and relieves pain in cancer patients, particularly in those undergoing chemotherapy. So most importantly, regarding our goals with Reiki Medic-Care, several studies have shown that Reiki improves relaxation and well-being in healthcare workers. And many studies indicate that Reiki energy helps regulate the autonomic nervous system and the endocrine system. And in particular, Reiki stimulates the vagus nerve, which results in a feeling of relaxation and stimulates release of acetylcholine, which is an anti-inflammatory agent. And this is how Reiki does some of its work in reducing the inflammatory response. Reiki also works if the practitioner is not even close to the client, not even in the same room, the same building, the same city, or the same country. If they intentionally connect with the client, they can transmit the Reiki remotely. And this version of Reiki is called distant Reiki. So we are all energy, and as such, we're all connected and part of a larger whole. And Reiki is part of that whole as well. And so it's reasonable to say that universal life energy, Reiki, transcends both time and space. Reiki is everywhere, so you can receive its benefits by just tuning into it as if you're a radio antenna. So another thing about Reiki is that it's a gentle energy, so don't expect it to act like a magic bullet. You may need several sessions before you notice a definite positive improvement. In fact, sometimes things get a little bit worse before they get better because Reiki tends to bring stressful issues to the surface. Reiki is also known as a subtle energy, so keep your eyes open for the small changes you experience in your mind and body and in how you react to little things. Reiki works on the subconscious mind, so after one session, you may not be aware immediately of any improvements. And you could notice benefits the following day or two, so be patient. An example is maybe you have a slightly tight sensation in your chest or your stomach when you're racing from patient to patient, and perhaps that tightness is lessening. Maybe you have woken up without a pain that you expect to feel when you wake up, even if the relief is brief and doesn't last long. Has the quality of your sleep improved? Maybe you're waking up fewer times in the night. And if you have found that you've fallen asleep during your Reiki treatment, perhaps you'll notice how deeply you slept. Was it different from how you normally sleep? And maybe you're finding that when you interact with that person who makes you feel inadequate, perhaps now you're able to maintain a sense of quiet confidence when you're with them, because Reiki improves not just physical health, but mental and emotional health too. And the effects of Reiki are cumulative, so you could become more sensitive to its effects over time. And so it may be useful to keep a diary and note any changes when you notice them. A slight reduction in that tension in your neck one day might not seem all that much, but when you add up all the little things you experience over a week, you might feel that Reiki is making a positive difference for you. And that is why Reiki practitioners treat themselves every day, to maintain a sense of well-being. So if you would like to learn Reiki so you can do Reiki on yourself, the Reiki Medic-Care team can guide you to the best resources to find a Reiki master who can teach you Reiki. So I hope that you now know a little bit more about Reiki and understand it a little bit better than before. And maybe you're a little more curious. Perhaps you'd like to find out more about it. I hope so. Thank you very much for your attention.